pregnancy and what are the ways to prevent it and what. So in this video we'll be discussing about how to prevent this iron deficiency anemia and how it is caused and what are the tips what can be there for preventing such kind of a uh, and developing anemia during pregnancy. So actually what happens is that during pregnancy it has been mostly seen that the amount of the volume of blood circulating increases. So during a normal course, when the lady is not pregnant, the volume of the circulating blood is absolutely whatever is the amount of the blood circulating. It's it's having the normal range. But during the pregnancy, since the pregnancy is to be sustained, so the amount of the blood, the volume of the blood in your body increases. And actually, anemia, it is caused due to the deficiency of iron. And when we talk of anemia, this iron deficiency, so actually there is a pigment which is called as hemoglobin. So this hemoglobin, it is a protein which is containing an iron fragment in it, an iron um, element in it, and this iron element along with the protein component is forming the hemoglobin, which is actually responsible for carrying the oxygen. So one hemoglobin is going to carry four oxygen molecules. It has got four sides to bind oxygen. So as the volume of the blood during pregnancy has increased, so once the volume of the blood during pregnancy is increased, obviously there is requirement of more RBCs to deliver oxygen to the fetus, because it is through hemoglobin only the fetus is going to receive the oxygen, as well as this oxygen will be required for fulfilling the nutritional requirement, as well as the growth of the fetus will be dependent on the amount of the blood supply, and through the blood whatever the nutrients and oxygen supply is given to the baby, it is through this iron. So anemia is going to develop in certain women during pregnancy just because the amount of volume of blood has increased, and since if they are not having the abundant amount of either iron reserves, or through diet if they are unable to compensate for the deficient iron, this anemia can be precipitated. So actually what happens is that just if the body is not having the adequate amount of iron stores, so the women can be anemic. Other risk factors also include that women who are during their non-pregnancy days also who had the problem of anemia. So such certain women who are non-anemic during their normal, without, when they were not pregnant, if they were having problems of anemia, such women are also more predisposed to developing iron deficiency anemia during pregnancy. Apart from this, if there are certain women who had heavy menstrual blood flow, because there are certain women who during their menstrual period they have their excessive menstrual blood flow is seen. So such women, they are also at a greater risk of developing this iron deficiency anemia. So when looking at the complications, what can it can lead to during pregnancy, so it can be looked upon as that if during pregnancy iron deficiency anemia is when somebody is facing, so ultimately this is the greatest cause of giving birth to a premature child. So the infant will be can born prematurely, and just because iron deficiency anemia has been attributed to one of the greatest factors for causing premature birth, that is birth which is below 37 weeks of gestation. So due to iron deficiency anemia, this premature birth can develop, and such babies will be born before 37 weeks of gestation. Apart from this, since the blood supply was not proper, the oxygen, the blood is through blood only the iron is the oxygen is going to reach the baby. So once oxygen impairment is there to the developing fetus, so ultimately the next complication is seen in the form of low birth weight babies. So during anemia, if during pregnancy, if the expecting mother is suffering from anemia, that can give rise to either a premature birth. Apart from this, the woman can also give birth to a low birth weight baby. So low birth weight babies are also one of the very important cause factor for factor which is caused due to iron deficiency anemia. Apart from this, this is also seen during certain researches. It has been found that the women who are suffering from iron deficiency anemia during pregnancy, they have a greater chances of uh, getting postpartum depression. So such women, they are at a greater risk that once their delivery has happened, once the childbirth is there, they are more prone, they are at a greater risk of developing postpartum depression. Now, the next risk factor, what can be seen, it is that since iron deficiency anemia, the blood supply to the tissue is the blood supply, as the oxygen supply to the fetus is hampered. So ultimately, it has been found during various studies that there is an increased risk of infant death immediately before or after birth. So these are the effects of iron deficiency anemia during pregnancy. Apart from this, when we look at the symptoms, so symptoms can be looked upon as that such women who are uh, expecting, and the symptoms what can be related to iron deficiency anemia can be looked upon as that they get very easily fatigued even while doing something, or even while they are relaxing also they have a feeling of constant fatigue. Apart from this, they can have weakness, they can feel weakness, they can have lightheadedness, it's just they can feel dizzy, so dizziness it can also be seen. Apart from this, they can have headache because of anemia, and since the blood supply, the oxygen is deficient, the hemoglobin is not the amount of hemoglobin is not sufficient, so actually they may also develop the pale and the yellow skin. So since the body's oxygen requirement is not met, so such expecting mothers, they can also feel shortness of breath. And the most important striking fact, which is to be very importantly remembered, that such women, they do have certain cravings for eating clay, for eating ice. So such cravings, which is also called as pica in medical terminology. So during pregnancy, such expecting mothers, they are experiencing the symptoms of pica, where they have an intense craving for to eat ice or chewing ice or eating on clay. So such symptoms can be seen from women who are suffering from iron deficiency anemia during pregnancy. Apart from this, when we look at the signs, what the doctors can examine during anemia, so it is actually a rapid heartbeat such women can have, such expecting mothers can be seen to have a rapid heartbeat. Their BP also falls down, and they find it difficulty in concentrating. Since the oxygen supply is less, the brain is not getting the appropriate amount of oxygen, so their BP, so they have a difficulty, they have a low BP. Apart from this, they have difficulty in concentrating as well. So the most important thing what needs to be remembered is the symptoms of anemia and the symptoms of pregnancy, more or less they resemble the same. So actually there is a great resemblance between the symptoms of pregnancy and the symptoms of anemia. So you should not be they should not be mistaken that these are the usual symptoms of pregnancy. They can also be there in symptoms of iron deficiency anemia. So both their signs and symptoms are more or less closely resembling. So what I advise is that mostly what should be done is that during the pregnancy, the expecting mother should be constantly, after every 1 month or 3 months, in every trimester at least, she should be screened for the iron deficiency anemia. Her complete blood cell count needs to be evaluated. The hemoglobin concentration needs to be checked at least in every trimester for the assessment of whether she might be developing iron deficiency anemia or not. So screening for anemia during pregnancy is a very, very important thing what needs to be carried out during the entire tenure of pregnancy. Apart from this, when we look at the treatment options, so the amount of iron what is needed during iron deficiency anemia, it is roughly approximately about 27 milligrams of iron per day. So actually this can be compensated through good nutrition as well as animal sources. So animal sources, the meat from the animal sources such as the lean red meat, the poultry and fish such women can take. And when it comes to the protein, the iron sources from plant sources. So in plant sources, what we can have, what the expecting mothers they can have is the fortified breakfast cereals, the dark green leafy vegetables and peas. So such green vegetables, green leafy vegetables, the rich cereal sources and the fortified breakfast cereals they can consume to get rid of this. One thing I would like to emphasize that the animal meat, when it is consumed, so the iron what is got through the animal meat can be easily absorbed by the body. But when it comes to the iron sources of plants, from the plant origin, it becomes difficult for the body to absorb such iron. So for such case, if it is a case of plant sources for purely vegetarian mothers, when we talk of, so the plant sources, the what the iron they are consuming, if it is they are consuming it from plant, they should pair it with vitamin C sources, because plant protein requires vitamin C supplementation to get absorbed. So actually when they are when they are fortifying their meals with plant sources of iron, they should accompany it, they should pair it with vitamin C sources like uh, lemon juice or orange juice, tomato juice or strawberries. They should certainly pair it up for the faster absorption of iron from the plant sources. So this is very important to be taken into consideration, and one must be do necessarily they should go for the screening from in every trimester of pregnancy to check for the hemoglobin levels. And this was a very short discussion where I tried my level best to simplify that what is it about the development of anemia, why does anemia develop during pregnancy, and what are the causes, what are the signs and symptoms, and how the what are the prevention tips what the expecting mothers can take to prevent the development of iron deficiency anemia during pregnancy. Viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And if you like this video, give this video a thumbs up. And students and viewers who are new to my channel, they haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.